What's up guys, Jeff from Sorta Healthy here. As you'd expect based on the title, today we'll be going over muscular anatomy that you should know as a personal trainer or massage therapist. In this video, we'll be focusing on the lower body. Just like in a recent video where I focused on skeletal anatomy, we'll be focusing on the basics. In other words, what I go over in these 3 anatomy videos, well, you should know at least that much if you want to work as a personal trainer or massage therapist. This information will help you pass a personal trainer certification exam like your NASM, ACE, NSCA, ACSM, etc. certification, and it will help you prepare for the test to get your license in massage therapy as well. Whether you're about to enter the field or you're an experienced vet looking for some review, I've got you covered. Throughout today's video, I'll be referencing a study guide. You can download this guide for free if you want to, or you can just follow along with the video. Either option can work well for absorbing the upcoming material. A lot of work went into making all of this stuff and keeping it free, and if you appreciate that, then I would very much appreciate you liking the video and subscribing to the channel if you haven't done so already. That very much helps the channel to grow, and it allows me to keep making free content for all of you. Thank you very much for that support, everyone. It's very appreciated. So a few quick notes before we get into the weeds here. First off, like I said, this video is meant to be very simple. I want to fill your head with stuff that you'll actually benefit from knowing when you're working in the field. If I try and teach you everything, including the stuff that isn't that relevant to trainers or massage therapists, you'll learn nothing, and that's no good for anyone. Second, for the major muscles, I'll be teaching you 4 things. 1, the location. 2, the action or what the muscle does. 3, the antagonist of the muscle. An antagonist is the muscle that opposes the prime mover, which the prime mover will be the muscle that we're talking about. And 4, a cool fact about the muscle to help you remember everything. We won't be talking origins plus insertions today. The origin of a muscle is the end of the muscle that is more stationary or stable. A muscle insertion is the exact opposite side of a muscle. It's going to be the muscle's distal attachment, distal meaning the attachment farthest away from the midpoint of the body. If you're a personal trainer, you don't need to know muscle origins and insertions. If you're a massage therapist, you still don't really need to have that information memorized, but knowing origins and insertions could be more useful. One last thing before I start breaking down muscles, if you are studying for a personal trainer exam or a massage therapy license exam, I only recommend that you watch each of these anatomy videos a few times. Knowing this material is useful, and some of this stuff could show up on the exam. That said, it's probably not the stuff that I would spend the most time studying. If you're a trainer, I already have videos on this channel that cover what you should be studying the most. So on to the actual muscles now. What do muscles do? Muscles are responsible for movement, posture, joint stability, and heat production. We have 3 types of muscles in our body. Smooth muscle, which lines the organs such as the bladder, stomach, and intestines. Cardiac muscle, which is located in the heart. And skeletal muscle. Skeletal muscle is the muscle that we usually think about when we're talking about muscles. Skeletal muscles are the ones that you can see and control. I can contract my biceps like this just by thinking about it. I can't control the muscle in my stomach or heart the same way. And really, when you think about it, we should all be grateful for that. Imagine if you had to think about digesting for it to happen, or if your heart only beat when you focused on it. That would make life way harder. Anyways, we're focusing on skeletal muscle today, and that's it. So now we're jumping into muscle locations, muscle actions, and so on and so forth for the lower body. You don't have to memorize everything that I'm about to say, but you should have a general understanding of everything I'm about to mention. Also, if you're struggling to understand different muscle actions like flexion and extension, make sure to watch the entire video. I'll be going over muscle actions throughout the entire video, but there's going to be extra review for those at the end. And on that note, let's get to talking about some specific muscles in the lower body. We're kicking things off with the quads, and you have 4 different quadricep muscles. You have the vastus lateralis, the vastus intermedius, the vastus medialis, and the rectus femoris. So we're starting off with the 3 different vastus quadricep muscles and the vastus lateralis. Well, you can see it here on the outside of the front part of the upper leg. We have the vastus intermedius, and if you can't tell by this picture, that kind of goes right down the center part of the front part of your upper leg. So on this picture, the vastus intermedius would be right here. And then on the inner part of your thigh, you have the vastus medialis. So your vastus lateralis, your vastus intermedius, and your vastus medialis, all 3 of those muscles extend the knee. And knee extension looks exactly like what I'm showing you in this quick little video. So the antagonist muscles of these vastus quad muscles are your hamstrings, and that's because the hamstrings perform the exact opposite action. The hamstrings are also on the opposite side of the body, and one thing you'll notice about prime movers and antagonists, well, basically the antagonist to that prime mover muscle, it's going to be on the opposite side of the body almost every single time. And a fun fact about the quads, your quads should actually be significantly stronger than your hamstrings. On average, a person's hamstrings are going to be about 30% weaker. Now, like we said, there is a fourth quad muscle, and that fourth quad muscle is the rectus femoris or rectus femoris. Just like vastus lateralis, vastus intermedius, and vastus medialis, rectus femoris also extends the knee, but unlike those other muscles, rectus femoris also flexes the hip. Hip flexion looking like what this guy is doing right here. And of course, like we said before, the rectus femoris is one of the muscles that is enabling this movement to happen. So if you want to throw a front kick at someone, like what Anderson Silva is doing to Vitor Belfort right here, well, your rectus femoris is going to be one of the muscles that's going to help you do that. By the way, like I mentioned before, I will be going over muscle joint actions later in this video. I'll be reviewing all of that stuff multiple times throughout this video. So if you're struggling with that, just bear with me for right now. So just like with the other quadricep muscles, the antagonist of the rectus femoris, that's going to be the hamstrings. Some fun facts about the rectus femoris. It is superficial to the other quadricep muscles. That means that the rectus femoris is actually on top of your vastus lateralis, your vastus intermedius, and your vastus medialis. So those other quadricep muscles are deeper than this rectus femoris. Also, the rectus femoris is the only one of the 4 different quadricep muscles that fully crosses the hip and the knee, and that allows it to do 2 different actions, extending the knee and flexing the hip, unlike the other quadricep muscles, these vastus muscles, which can only extend the knee. Moving on to the hamstring muscles next, you have 3 different hamstring muscles. You have your biceps femoris, your semitendinosus, and your semimembranosus. And in this first slide on the hamstrings, we're just going to be focusing on the semitendinosus and the semimembranosus. Okay, so the semitendinosus and the semimembranosus, they actually do a few different things here. They flex the knee, they extend the hip, and they medially rotate the leg at the knee. When you hear hamstrings, the 2 actions that I want you to think about are knee flexion and hip extension. When it comes to knee flexion, the hamstrings are the muscle group that's mainly responsible for that. When it comes to hip extension, the hamstrings are still really important, but they're not necessarily the muscles that are doing the most work. And I wouldn't worry quite as much about this last bit right here. So the antagonist of the hamstring muscles, those are the quads, and that should make sense based on what I said before. And if you're into athletics, you probably already know this last bit, but the hamstrings are some of the most commonly pulled muscles out there, with maybe the only other muscle groups being more problematic, being some of those in the lower back. So knee flexion, that muscle action that the hamstrings do, that's what this girl is doing right here as she's doing this hamstring curl exercise. And you can tell it's flexion because the joint angle of her knee is shrinking as she's curling that weight upwards. So remember, if the joint angle is getting smaller, it's flexion. If the joint angle is getting bigger, it's extension. Next up, the third and final hamstring muscle, biceps femoris. So we're mostly looking at the same muscle actions as before. We still have knee flexion, we still have hip extension. This time though, we're looking at lateral rotation of the leg at the knee. Just like before though, when you think about hamstrings, I want you to think about knee flexion and hip extension. You don't necessarily have to worry about this part right here all that much. So the antagonist here is also the quads. And the reason this muscle is called the biceps, bi as in 2, is because the muscle has 2 origins or places where the muscle starts, which you honestly can't really see too well on this picture. But yes, when you see the biceps here, that means the muscle has 2 origins, again, being 2 places where the muscle starts. Next up, we have the glutes, and we have 3 different glute muscles. We have gluteus maximus, gluteus medius, and glute minimus as well. Starting off with glute max, this big old butt muscle right here. Its actions are, it is a strong hip extensor, it externally rotates the hip, and it helps to support the knee. So before, when we talked about that quadricep muscle rectus femoris, we talked about hip flexion, this kind of kicking forward motion. Basically with glute max, we're talking about the exact opposite movement. We're talking about hip extension, and the hamstring muscles also help out with hip extension. However, glute max max is the strongest force and strongest muscle for generating this muscle motion right here. So because glute max is such a strong hip extensor, the antagonists that we're thinking about here are the hip flexors. Rectus femoris is one of those hip flexors, but we'll talk about a few more of those later on. And a fun fact here, glute max is the biggest muscle in the body, and that's not just on some people, that's on everybody. Even if you have a small butt, glute max is still the biggest muscle on your body. Next up, we'll be talking about glute minimus and glute medius. And they kind of work together to abduct the hip and prevent adduction of the hip. Basically, they help keep the knee stable. So when we're talking about hip abduction, we're talking about bringing that leg up and out to the side. The antagonists of these two muscles are the adductors and the lateral rotators. We'll cover those muscle groups soon. Extra work on these muscles is great for people with knee issues. That is very true. Honestly, if someone is having knee issues, oftentimes it's because glute minimus, glute medius, and glute max, well, they're not doing what they're supposed to do, so you want to focus on strengthening those muscles. Next up, we're talking about the deep six lateral rotators, and these are actually other butt muscles or hip muscles. These ones are deep though, as the name would imply, and we don't need to memorize all 6 of these muscles here. We're just going to go over all of them very briefly. Anyways, what these 6 muscles do is they laterally rotate the hip. So the antagonists for these 6 muscles are glute medius and glute minimus, which of course we just talked about. And these muscles, like we said, they laterally rotate the hip, so turning that hip outwards. Glute minimus and glute medius, because they abduct the hip and they prevent adduction of the hip, which again, I'm kind of showing you what those look like on the screen right now. They tend to internally rotate the hip a little bit while they're doing what they do. And again, because of that, they oppose these deep 6 lateral rotators. Honestly, the only one of these 6 muscles that you're likely to hear about or talk about in the field is the piriformis, and that's because it's responsible for many cases of sciatica. But yeah, the piriformis, which you can see in this picture right here, it's a deep muscle that likes to kind of clamp down on that sciatic nerve every once in a while, usually if someone is just sitting too much, but there are other things that can cause this issue as well. And there are different stretches and massage therapy techniques that you can do to help out with that. Anyway, moving on to the tensor fascia lata. That is a mouthful right there. You can just call it the TFL for short. The TFL is much easier to say and remember. So the TFL is actually a very interesting muscle. It does a whole bunch of things. However, it's not the main muscle responsible for doing pretty much any of these things. It's really just a synergist, meaning it's helping out other muscles accomplish these things, such as flexing the hip, medially rotating the hip, so on and so forth. Again, the TFL is more so just assisting these different movements in happening. Because one of the things the TFL does is hip flexion, the antagonist of the muscle for the most part is glute max, because again, glute max does hip extension. The TFL is also a hip abductor, so adductor magnus, which is an adductor, the opposite of abduction, well, that is also another antagonist for the TFL. So some good stuff to know about the TFL. The TFL feeds directly into the IT band. And fun fact about the IT band isn't muscle tissue at all. It's really much more of a tendinous structure. So you can't actually loosen your IT band the same way that you could loosen a muscle through stretching. Anyways, when the glutes are too weak, the TFL can cause knee pain. Basically, the TFL and the glutes both attach on the hip, and when the glutes are too weak, which they often are from too much sitting, this causes the TFL to become overactive, and that can cause knee pain, especially on the outside portion of the knee, which you can see right here. Okay, so next we have the adductor muscles of the hip, and just like with the lateral rotators, we don't really have to memorize all of these different adductor muscles. We got the pectineus, adductor longus, adductor magnus, the gracilis, and adductor brevis. And no surprise to anyone, these muscles adduct the hip. So the antagonist for these muscles is glute medius and glute minimus, and that is because glute medius and glute minimus, they abduct the hip, which again, abduction is the exact opposite of adduction. Like I said before, don't stress if you don't have all of these different muscle actions memorized yet. it will make sense over time. Anyways, your adductors can be overactive, and that can draw your knee inwards during a squat, and that makes sense because, again, these muscles pull the hip inwards towards the body. So if these adductors are adding your hip back to your body with too much force relative to other muscles, they would cause your knee to cave inwards during a squat. Speaking of muscles that aren't quite as important, no hate towards the Sartorius. It's actually a pretty cool muscle. It does a whole bunch of different things, and just like the TFL that we talked about before, it's not the main muscle responsible for any of these different actions, but it does assist in a whole bunch of different actions, making it a pretty good little synergist muscle. And I really shouldn't call it little because it is actually the longest muscle in the body. Like I said, it is a synergist for a bunch of different movements. And you can make a few different arguments as to what the antagonist of the Sartorius is, but it doesn't really matter because, again, the Sartorius isn't really a prime mover of any movement. Okay guys, so next up we're focusing on psoas major, psoas minor, and iliacus. And make no mistake, psoas major is definitely the big player right here. But basically these three are strong hip flexors, and make no mistake, like I just said, the psoas major is definitely the strongest of this three muscle bunch. They also assist in hip external rotation. But again, when you're thinking of the psoas muscles and the iliacus to a lesser extent, I want you to think of hip flexion, what this dude is doing right here. And this would be hip flexion whether he's standing, which of course he is standing in this picture. If he were laying on his back, it would also be hip flexion, and the psoas would be very much in play in that situation. So the antagonist here is glute max, and that would make sense because we're dealing with strong hip flexion here, and glute max, well, that's the strongest hip extensor. So again, makes total sense. So if you want to address all three of these muscles at once, you could call them the iliopsoas. Also, over tight psoas muscles tend to cause some problems. A lot of hip pain or low back pain in particular is caused by over tight psoas muscles. Okay, so up next we're talking about the gastrocnemius or the gastroc and the soleus. Primarily what both of these two muscles do is plantar flexion, and plantar flexion is pretty much what it sounds like. It's where your foot is being planted down against the ground, and I'll show you guys a little bit more about plantar flexion and again the other muscle actions too very shortly. Unlike the soleus, which technically only attaches here on the ankle joint, the gastrocnemius attaches on the ankle joint and the knee joint, and therefore the gastroc also does help out with some knee flexion as well. Granted, it is not the primary muscle responsible for that action. The main muscle that opposes these two muscles or plantar flexion is the tibialis anterior, and no surprise, the tibialis anterior is on the opposite side of the calf. Both of these two muscles are on the back side of your calf, and the tibialis anterior is on the anterior side or the front side of your calf. Quick little fact about both of these two: the gastroc is used more for explosive movements and the soleus is used more for endurance. So if I'm sprinting, the gastrocnemius is almost certainly the muscle that's doing more work. If I'm kind of just standing around for like a long period of time, or maybe walking at like a slower pace, there's a good chance the soleus will actually be doing a lot of the work in that case. So now we're talking about the tibialis anterior, and no surprise, the tibialis anterior, that's the muscle on the front side of your calf. The main thing the tibialis anterior does is dorsiflexion, which is kind of when you lift your foot up off of the ground like that. Again, I'll show you more of that stuff in a sec. And no surprise, the antagonist of the tibialis anterior is the gastroc or the soleus. Again, they're on opposite sides of the leg and they perform opposite movements. I guess I wasn't really all that creative with this fun fact right here, but yeah, the tibialis anterior is the largest muscle on the anterior or front part of the calf. So a quick little note here, we did skip a lot of lower body muscles. It is possible that at some point in your career you might need to know more, but for right now you probably won't. So yeah, long story short, in my opinion, the lower body muscles that we went over today, Those are the most important ones for you to know. There are other muscles that could be important later on, for example, your popliteus, which is a muscle in the leg that is used for unlocking the knees when walking. You also have muscles like the fibularis muscles, which used to be known as the peroneals. So you have fibularis longus, fibularis brevis, and they aid with plantar flexion and foot eversion. And at some point in your career, you may need to do extra research on muscles like that, or maybe other muscles located within the foot, which honestly, we're not going to be talking about at all in today's video. You're better off understanding the different movements that the foot and ankle can do, rather than memorizing all of these different foot and ankle muscles. Because again, 99.9% of you watching this video are pretty much never gonna have to deal with these guys anyways. So on that note, I'm going to play an older clip where I break down the different movements such as adduction, flexion, plantar flexion, etc. And I'm gonna do that because knowing that information is useful and that will help you understand everything that I went over today. It should also help you leading into the video on upper body muscles too. So now on to movements. Anyway, we have three different planes. We have the transverse plane, the frontal plane, and the sagittal plane. The transverse plane divides the body into top and bottom halves. The frontal plane divides the body into front and back halves. And then we have the sagittal plane, which divides the body into left and right halves. Next up, we'll be talking about the movements that take place in each of these planes. In the sagittal plane, we have flexion, which is a decrease of the joint angle. We have extension, which is an increase of the joint angle. We have dorsiflexion, which is moving the top of the foot towards the shin. And then we have plantar flexion, which is moving the sole of the foot down towards the ground. So flexion would be this, because as you can see, I'm decreasing the joint angle here. It is going down. Extension is the exact opposite. Look, as the joint angle is expanding here. So it's going up, so that's extension. Can't really show you dorsiflexion and plantar flexion, but dorsiflexion is literally if I just kind of pull my toes up towards my shin, so I'm lifting my foot up off the ground, and plantar flexion is just me planting my foot back down to the ground. So pretty self-explanatory, I think. And again, all of those are movements that go in the sagittal plane, so this one right here. And I have a good way to remember all of that, so we'll be going over that in one sec. So if we look at this sagittal plane that divides the body into left and right halves, we see that it kind of goes out in front of the body, and it also kind of goes back behind the body. So basically, again, it's going in front of the body, and it's going behind the body. So the way you remember which movements go in the sagittal plane is they go in front of the body or they go kind of in back of the body. Again, if we look at flexion and extension, flexion is kind of happening in front of the body, and if we look at extension, it's kind of happening back behind the body. It would happen even more if I was doing extension with the shoulder. This brings me to the frontal plane, which divides the body into front and back halves. So the sagittal plane goes this way and this way to the front and the back of the body, and the frontal plane goes to the left and the right of the body. We already said that because the sagittal plane, the movements follow that plane of motion, so to the front and the back of the body. Where then do these movements in the frontal plane go? Yes, you're probably thinking it right now. They go to the right and the left of the body. So if we're looking at this other picture, again, they go to the right and the left of the body. So movements in the frontal plane, we have adduction, or movements toward the midline. I'll show you all of these in a second. We have abduction, abduction, movement away from the midline of the body. We have elevation, moving to a superior position, scapula. Depression, again, that's scapula. Don't really need to worry about that so much. We have inversion, tilting of the foot towards the midline. Don't really need to worry about that one too much as well. And eversion, tilting the foot away from the midline. For inversion and eversion, I would actually look these two up on your own. They're fairly unlikely to appear on your test. These are pretty good to know though. For elevation and depression of the scapula, these are incredibly unlikely to appear anywhere on your test. However, adduction and abduction, these are fairly likely to show up on your test in one form or another. So we already said movements in the frontal plane go to the right and the left of the body. So the way I remember adduction and abduction, or adduction and abduction, is adduction is when I'm adding my arm back to the body. And abduction or abduction is when I'm moving my arm away from the body. Next up, we're talking about movements in the transverse plane. And again, the transverse plane divides the body into top and bottom halves. This is probably the most confusing of the three. And with the frontal plane, we see that this clearly goes to the right and the left of the body. With the sagittal plane, it clearly goes to the front and back side of the body. And then we kind of have this weird little rotation-y thing here. But it's important to notice that because for the transverse plane, most of the movements have a rotational component. So scrolling down to movements in the transverse plane, of course we do have rotation, blah, blah, blah. We also have pronation, which I'll show you guys what that looks like in a second. But basically it's rotating the forearm or foot palm side down. We have supination, which is pretty much the exact opposite. We have horizontal abduction or horizontal abduction. I'll show you what that looks like in a second. And we also have horizontal adduction. I'm also going to show you guys what that looks like as well. So rotation could be a whole bunch of different things, like essentially if I'm doing a torso rotation and I'm rotating like that with a cable or a band, of course that is an example of rotation. Pronation would simply be this, palm side down with my hand and wrist. And supination would be the exact opposite of that. And the way I like to remember supination is cup of soup. So that's what supination is, going from this to that, and you remember supination by cup of soup. Next, we have horizontal abduction and horizontal adduction. I'm actually going to show you horizontal adduction first. Pretty much what that looks like would be a fly motion. So kind of like this sort of a motion if I'm doing it on both sides here. If I'm doing one arm at a time, it kind of looks like a punch where I'm punching across my body like that. Think of it like I'm adding my arm back to my body. Horizontal adduction. And then horizontal abduction would be the exact opposite. So it's me coming back like that, okay? So horizontal adduction would be fly motion. Horizontal abduction or horizontal abduction is basically the exact opposite, so almost more of like a reverse fly kind of a motion. At the end of the day, remember this: if the movement has any kind of a rotation in it, it's going to go in this transverse plane. Now that we've broken down lower body muscle anatomy that you should know and anatomical movements, you should go review upper body muscle anatomy next. There will be a link to that pinned right down below. If you're watching this video right after its initial release, that video should be out in a week or two, so stay tuned. The skeletal anatomy, lower body muscle anatomy, and upper body and core muscle anatomy videos are all meant to give you useful baseline knowledge. And I'm not saying you have to memorize every detail shown in these videos, but you should be somewhat familiar with everything. That's all that we have for today, everyone. If you haven't done so already, please consider liking the video and subscribing to the channel, because both of those things do very much help the channel to grow, and that allows me to keep making free content for all of you. Thanks for watching, everyone. Until next time, stay sorta healthy.